So I look at the cost of labor every month. So on our financial reports, we can see our labor dollars over or under, and ultimately that's a big factor in this. And when I see them over, then I look at the why. So, and a big part of it is people not taking their lunch. There'll be staff that never take a lunch, and so it's identifying who those folks are. But the labor dollars is a huge factor in why we picked this up. Running over hours PPD, and also, as you said earlier, like labor laws and potential litigation. In most states, it is required by law to take a break, and in some, it must be a full 30-minute break. It can't be a minute less. So for those reasons, for people running over, and also to helping the employee, taking the time off is important. So in Cover, we use two primary tools. One is called Managed Lunch Breaks, and that pulls up at a time period that you want, a week or a month, who's missed lunches. Are they early lunches? Are they late lunches? Are they perfect? So you can track all kinds of interesting data. And then also today's lunch break reminders, which was the texting feature where the supervisor can text those folks, hey, you're missing your lunch. We also look at, of course, payroll data and the monthly financial reports just to see how things are going, and we track and trend that information. In order to make an impact, you have to have a cadence that is frequent enough to get people to understand it's important. So most of my facilities will look at this daily in stand-up. You actually pull up Cover on your TV or computers in the morning and review. You can also, in the software, print individual staff reports and be able to sit down with them and show them how many missed lunches they have versus correct lunches. And I think that feedback is important to give them the exact feedback on how they're doing. I think when you're looking at missed lunches, I recommend focusing on narrowing the focus at first. If you try and tell everybody to take a lunch every day, it's hard. You can use the texting feature, which is fabulous. But those individual conversations about why they're not doing it, people that aren't becoming more compliant with taking lunches, I would sit down with them one-on-one. And it doesn't have to be the director of nursing or the executive director. The department managers can do that. The nurse managers on the unit can do that. Where they sit down and have conversations and understand it's a priority for their health and for the facility. And you have to be consistent with follow-up. You can't just do it once and think they'll change. You have to do it 3, 4, or more times sometimes to get people to change their behavior. I also believe it is important to have a carrot, reward and recognize those that are doing better. I love the idea of a competition. On your own departments or units. Maybe somebody gets a pizza party if they have reduced missed lunches. You can reward individual staff in different ways. That can be very low cost. So I think it's important to have consistent review of this, to reward. And then if people aren't following up or following through on doing missed lunches, then there has to be a plan for that. What is your progressive discipline? Education is always the best way to start, but unfortunately, some people won't get it until they have a corrective action or one-on-one, maybe with the executive director or the director of nurses. So following a lot of the tools in Cover, a lot of these ideas, you will make an impact in your missed lunches. It just has to be consistent and frequent to make that impact.